This is for informational purposes only. For medical advice or diagnosis, consult a professional. There are many natural ways to increase your chances of getting pregnant. Here are a few tips. Time intercourse correctly. Have sex every other day leading up to and including ovulation. Sperm can live for up to 5 days in the female reproductive tract, so having sex frequently increases your chances of conception. Track your ovulation. Use ovulation predictor kits, basal body temperature charting, or cervical mucus monitoring to identify your fertile window. This will help you time intercourse for optimal chances of conception. Maintain a healthy weight. Being overweight or underweight can affect fertility. Aim for a BMI between 18.5 and 24.9. Eat a healthy diet. A balanced diet rich in fruits, vegetables, whole grains, and lean protein can support fertility. Folic acid supplements are also recommended for women trying to conceive. Reduce stress. Stress can negatively impact fertility. Incorporate relaxation techniques like yoga, meditation, or deep breathing into your routine. Limit alcohol and caffeine intake. Excessive alcohol consumption and caffeine intake can reduce fertility. Get regular exercise. Moderate exercise, such as 30 minutes of brisk walking most days of the week, can improve fertility. Avoid smoking. Smoking significantly reduces fertility in both men and women. Get enough sleep. Aim for 7 to 8 hours of sleep per night to support overall health and fertility. Consider preconception counseling. A healthcare professional can provide guidance on optimizing your fertility and preparing for a healthy pregnancy. Remember, it can take some time to get pregnant, even if you're doing everything right. If you've been trying for over a year without success, it's important to consult a doctor to rule out any underlying medical conditions.